I have just the audio on my computer, but I can put it through my phone if you don't hear me that well.
I can hear you just fine.
Okay.
So let's chat. How's everything been going since the last time we talked?
Things have just been very busy. Everything's about vaccination and everything's about trying to get vaccine in arms, and that's what my life has been the last week.
So the state has talked a lot about challenges that they've had in rolling out the plan and communication with the federal government. I know you can't speak to the broader scope necessarily, but what are the challenges that you have seen?
Yeah, I think the biggest thing is that the state is getting a lot of pressure from the federal government saying you're not vaccinating enough. And then the state is getting a lot of pressure and putting the pressure on us to make sure we vaccinate enough. Well, for us, as we roll it out, to try to get the vaccine in the arms of the people next week when we don't know how much vaccine we're getting next week is really challenging. So they want us to use up just about as much as vaccine as we're given, but we actually don't know how much we're going to be given next week, so we can't schedule that far out. So it's really this rolling kind of catch-up game that we play. So we're planning on getting through next week with the vaccine we have in hand right now, and then we basically plan for the next week based on what we'll be notified about our allocation at the end now. So we know that if at this pace we're vaccinating right now, we're going to be completely without vaccine for first or second doses next week, Thursday or Friday. So
unless you get more, which could happen, you just don't know.
Exactly. So across the state, allocation dropped dramatically, and within Trinity Health, we had quite a few sites that got a dramatically lower number, and some actually got none this week. And so you just don't know. For us, we've been working really hard. We've been hitting probably 85 to 95% of the vaccine we use within a week. And so our allocation actually was full this week, and we got everything we asked for. And we were able to open up an additional site. So now we have 3 sites running, and we've been vaccinating a ton. And so we're cautiously optimistic right now, but it's this challenge. We want to keep on getting vaccine in arms. And then the second big challenge we have, so it's the logistics of that, but also just the big picture logistics of equitability and justice are really challenging because some of the individuals that have the greatest access and the greatest means are the ones that kind of hear about things first and kind of will jump in. So how do you ensure that people that are most vulnerable, some of our vulnerable populations, get access as well? And that's one of our big challenges.
What are you doing to try and meet those challenges when it comes to equity?
Yeah, so the thing that we're doing is that we're reaching out to some community partners, number one. So we're connecting very, very closely with the health department. So the health department gives us basically a population they would like vaccinated, and we send private links to leaders in that population. For example, GRPD, that was our responsibility to get them vaccinated. They're not necessarily vulnerable, but they are a group that we shared an individual kind of invitation to and got them in and scheduled. Now, we've also partnered with our St. Mary's Foundation, has reached out to a lot of the communities of color and the leaders. And so we're getting through a pretty big group of individuals as one of our soft launches to help try to engage communities of color in Grand Rapids. And so that's a huge priority for us. And then the other way is actually we have 2 different lanes to get into our schedules. We have a private link that we share with leadership. So superintendents at the school districts, leaders at law enforcement agencies, they get an invitation to get into things. But we know that that link will get shared. And we don't have great ways to kind of police who those people are that get scheduled into our schedule. And so then we also have a internal referral system where our offices can identify high-risk individuals inside our patient population that they only have access to that schedule. So for example, starting tomorrow, every single office has the ability to have a fixed number of doses that they can allocate to their highest risk patients and get them in with a reserved space that don't rely on technology. So we're actually reaching out to those patients, and we're trying to kind of make it a more community effort where the offices that know their patients best, those case managers, those people that are helping connect patients to the healthcare system, are reaching out to them and getting them in. And so that's our approach, is taking that two lane, the internal referral that's really a lot of work, but also this external kind of community outreach, and we're doing that simultaneously.
If you had more vaccine doses, could you handle giving out more, or are you maxed out at what you have now?
Today we're maxed out. Next week we could probably do more. So, I mean, for example, last week, Friday, we kind of found out that we were going to be able to get more doses. And so this week we launched another site that can do up to 800 doses a day. And quite literally, we stood that up in 48 hours and we started running there yesterday. And so, we are actively trying to hire a group of contracting nurses, also a group of, we're bringing back some recently retired nurses, we're bringing back staff from everywhere and kind of calling on all of our leaders in the community in our organization to kind of step in. So yesterday we had director level individuals that were out at the vaccination clinic at this new soft launch, because they're like, okay, we can drop a meeting or two and we're out there doing it. And so we have the ability to kind of get things stood up and move quickly. And so it's this really interesting challenge of what do you do today, what do you do tomorrow, and then planning that week ahead for how much capacity we're going to have, and then meeting that. Because we don't want to be in a scenario where the state says, oh, you only used half your doses, we're not giving you any more next week. We don't really want to give them that opportunity.
So if you knew that you were going to have 1,000 more doses, you'd find a way to be able to give those doses.
Absolutely, yeah. Yep.
So there's been a lot of talk on the federal level about giving out all of the doses so that more people can get a first dose rather than reserving any for a second dose. Do you see any problem with that?
Yeah, I do. If we knew exactly what we would get, potentially we could, then we could probably meet demand and meet need and get it in the arms. But right now, if we just got 20,000 doses dumped in our laps, it would take us a few weeks to figure out exactly how to do that, because we just have not been told that's going to happen. So right now, you look at the big issue is the actual infrastructure for delivery that takes a little bit of time to ramp up. Until December 17th or something, we didn't even know when the vaccine was coming, if everything was going to be approved, and how that was going to work, So this is all these healthcare organizations in our decentralized system have had a ton of pressure put on them to try to get this done in a very short amount of time. And then they're kind of held accountable for not doing it fast enough. But it's hard because we're still delivering COVID care, and we still have contracting nurses that we've tapped all of our kind of auxiliary support out there because we've dedicated so much time and energy just to take care of people with COVID. For example, we set up like this big COVID call center to help answer questions for patients, get them into testing, and help triage their health issues, because our call volumes to our offices went up so much. So we have 20 to 30 nurses dedicated to that call center that are not our own nurses, because we didn't have capacity. So we already went outside of our typical referrals, dragged all these people in, and now we're like, we need lots more nurses, and where do you get, and it just takes time. And so I think that what's happening in the community, I think, is a little bit of frustration too, because they feel like there's a lack of transparency and there's not enough communication out there about what's happening. But we can't communicate what we don't know. And that's, I can tell you exactly, we're going to get through probably 6,000 doses next week. 6,000 to 8,000 doses next week. That's what we have scheduled. That's what people are on the schedule. We opened up some schedule and it filled up within an hour or two for next week. But we have no one scheduled the week after that yet, because we just are waiting to hear what we're going to get sometime tonight or to Friday night. So it is a exceedingly big challenge.
So logistically speaking, it would be problematic to suddenly get all those doses if on a federal level they do that and not reserve any for a second dose. What about
Absolutely.
medically speaking? Do you see any problem with using everything for first doses and maybe then some people will have to wait to get their second dose? Medically speaking, is that an issue?
It potentially could be. We don't know is the real answer. So, we don't have a ton of experience with this vaccine yet. I mean, we have millions and millions of people that have received it. And so we know that it's safe and we know that it likely is going to work from the studies. But a lot of that stuff is just an unknown. We can only operate within the research that was given to us. And we know that they timed things at 3 weeks. And we didn't, and as an organization at St. Mary's, we've not been interested and we're not planning on extending out those doses. Now, we are taking a little bit of what the state has told us at face value, which has said, don't hold back for second doses because we will get you those. So we're kind of hedging our bets. We're giving all the first doses, but we're not scheduling first doses out beyond what we know is coming into us. So if we get half our allocation next week, the potential downside is the week after that, we're only going to be doing second doses and no new first doses. And it's going to be this big accordion effect. And so I think that if you asked any of us, we would rather have just a big surplus so that we could ensure everyone had the vaccine they need for first and second doses, and then say, we'll figure out a way to use it. That's probably better in general than where we're at right now, which is basically not knowing what we would get. It would be better for the community too, because if they knew they were getting vaccinated in a month, we wouldn't get as many phone calls and there wouldn't be as much anxiety in the community. If you knew that you were scheduled at some point down the road, even if it was weeks out, it would feel better than this kind of limbo land that everyone's living in right now.
Thank you for taking the time to talk to me this morning, Dr. Jameson. Let's continue the conversation because every week there are new questions and
Oh man,
like
it is so crazy.
So I appreciate you, and I'll get in touch with Amy again when so we can schedule another conversation. But thank you.
Absolutely happy to do it. You take care.
You too. Thanks.